Morning to everyone. So I'm very glad to attend this international conference on exploring the interdisciplinary life science, frontiers of life science. It's a very pleasure to share my some ideas regarding the hospital waste management tool, how the hospital waste are managed by internationally and then locally. That's the thing. I will share my PPT. So this is today I'm going to talk about the medical waste management in healthcare facilities. So first of all, the healthcare activities are very helpful to our life. But one thing we should know, the healthcare activities waste. So that is the biggest question mark. Another one is in the total amount of the waste generated by the healthcare activities. About 85%, 80 to 85% are general non-hazardous waste. But 15 to 20% of the waste are very highly dangerous, that is hazardous materials. Those waste contain infectious agents, toxic materials, carcinogens, flammable materials, corrosives, and reactive chemicals, even explosive or even in the radioactive materials are there. So those hazardous, how the hospital environment or healthcare facilities, healthcare providers, how they dispose, that is the question mark. The $1 million question marks are how they dispose. So that is the main one. So as per the WHO report 2023, every year an estimated 16 billion injections are administered worldwide, isn't it? But not all the syringes and the needles are properly disposed afterwards. That is a question mark, isn't it? These are the sources. Here I have given many sources of healthcare waste generated by the sources. For example, hospitals and other healthcare facilities providers, they are the major people, and the blood bank and the blood collection centers, nursing homes, diagnostic laboratories, mortuary and autopsy center, even animal research and life science research and testing laboratories. They generate waste, healthcare waste and human waste. So those waste, how they manage, how they dispose properly, that is the main issues nowadays. So those biohazards, the pathogens, they transmit from the water, from the patient blood, or other body fluids, or maybe through the oral, or maybe through the orophycal route, they may transfer. And the laboratory cultures also, microbiological stocks, even the patient excretion, and many other infectious agents, not only the viral agents, bacterial, protozoan, all will be considered as infectious waste. Then sharp waste, especially hospital needles, infusion sets, scalpel, knives, blades, broken glasses, even the intravenous IV needles, how we dispose. So that is considered as a type of waste, hospital waste. And even the chemical waste, like solvents, the solvent chemicals and reagents to use it for some test, it's a medical test, and disinfectant, sterilant, and heavy metals, especially mercury in the broken thermometer, and even in the hospital electronics batteries. Such kind of waste, they have classified, they have typed infectious waste, pathological waste, sharp waste, chemical waste, like that. Even the pharmaceutical and the cytotoxic waste, especially one of the drug is called methotrexate. The methotrexate used to make the cancer cell be static and kill the cancer cell. So such kind of drugs will act as a genotoxic and damage our DNA. So, and the radioactive waste materials. So environmental risk associated with the healthcare waste disposal. Suppose when you dispose the healthcare waste, is for example medicines, used medicines, and then sharp materials. So what will happen if they dump in the dump yard? So the dump yard environment will be disturbed, completely changed their nature. And if you dump it in the drinking water sources like a lake, pond, other things, the water will be contaminated. So hazardous chemicals that will also very highly potential source of water pollution through the sewerage system. And the sharp needle, as we discussed, the sharp needle, if the person who has an experienced, for example, needle stick injury, so what will happen? The people will get the needle stick injury while accessing the waste, or animal or the human. They may get the needle stick injury, isn't it? So there are chances are there 30% or 1.8% or 0.3% chances are there they will become infected with the hepatitis B virus, hepatitis C virus, even HIV also. So the WHO, they have reported, so nearly 30% of the population, they got the hepatitis B virus through needle stick injury, and hepatitis C virus also, even HIV also, especially in the low income countries and developing and underdeveloping countries. So to avoid such kind of the confusion, such kind of mess in the world, so the WHO and as well as World Bank, they did the joint collaboration. They formulated the guideline how we manage, how to manage the healthcare waste. Listen, that is the thing. What purpose they want to prepare the guideline, the healthcare waste management. Because the healthcare management, if you do manage properly the healthcare waste, then the hospital environment will be hygiene. The entire society, community will be hygiene, and the healthcare workers will also be safe from the healthcare waste. And then staff behavior, because while they are accessing the waste, most of the people, they deny to go there and then work there. So that is also behavior should be, the staff behavior should be related to the handling the waste. And so in Western countries, every month they are going for evaluation like that. So this is the main guideline. The WHO, in collaboration with the World Bank, they prepare the guideline. So what are the advantages of if you maintain the healthcare waste in a good management? We can control the nosocomial diseases, the hospital-borne diseases, and reduce the community exposure to multi-drug resistant bacterial pathogens, and then sepsis-causing bacteria like Streptococcus pyogenes and Streptococcus pneumoniae and Haemophilus influenza. Many bacteria are there. They're very highly dangerous causes. They cause infection, sepsis, especially in the comorbidity patients. Hepatitis B virus, hepatitis C virus, all will be, and even we can cut the infection chain, in the cycle, and we can ensure the healthcare workers' safety issues and reduce the risk of needle stick injuries. And mainly, especially in the poor countries and the low-income countries and some developing countries, they are reusing the medical waste, especially syringes and catheters and then IV bottles, all are there. So we prevent the illegal repacking, reselling the contaminated needles, and avoid negative long-term health effects like a cancer and other things. And the social acceptance, the surrounding residential areas or the public people or parks or many things are there. So how the people accept those waste, that is the main things are there. So for example, the WHO reported high-income countries, but low-income countries, they generate only 200 milligrams of hazardous waste. But the problem is the high-income countries, they have a policy to dispose their hazardous waste and manage the waste. But low-income countries, those 200 milligram waste, the hazardous waste, they mingle with the non-hazardous waste. So if they dump it in the normal dump yard or the municipal dump places, so it will be more dangerous to the public. So according to the report 2021 by the WHO, UNICEF, 61% of the hospital had basic healthcare waste service in 2021. In the case of 2023, so it totally was far worse. 25% of the healthcare facilities had basic healthcare waste management service. Now become worse. In many countries, they are not following the healthcare hazardous waste management. So that guidance, if every country follow, that will be fantastic. We can manage the healthcare waste products. So the healthcare staff shall be trained on the proper waste management, and every healthcare hospital, healthcare facilities, they assign the staff, but the separate staff. So Abu Dhabi is a capital of UAE. We should follow the guidelines. So every hospital should assign the faculty for the waste management. Separate department, healthcare waste management department should assign in every hospitals. And then the staff should be trained, and the general waste should to be stored in a separate room at facilities or municipality. So they have to contact the municipality to take the waste, especially non-hazardous waste. And all infectious waste and other waste considered as a hazardous waste must be stored in a designated area with limited access. If the hospital store the infectious waste, should be disposed within 24 hours. All the laboratory waste shall be stored in a refrigerated, lockable, and then closed storage, and pending disposal, all should be maintained. Regular inspection of leakage or label deterioration, all should be monitored. If the healthcare staff, especially the healthcare waste management staff, they should inspect regularly every 12 hours once. They have to go on the check whether the waste are leaking or the labels are properly maintained, like that. So for example, waste bag, whether they are using the waste bag container, should be sealed or labeled with the address of producers and the waste category marked with the biohazard sign of medical waste. Waste should be stored close to patient where the foods are prepared. So any kind of waste, it should not be stored near to the patient side or the foods preparing area. So here we have to go for the federal regulation. The healthcare authority, the Ministry of Health, so they prepare the regulatory things. So the guidelines, as per the federal regulation, we should follow. For example, packing and the color code of the medical waste. Group A waste, Group B waste, Group C waste, like that. Group A waste, that is anatomical and pathological waste, heavy duty, polyethylene red color bags are clearly marked that one. For example, in this red color bag, all anatomical and the pathological waste should be dumped in a heavy duty polyethylene. That gauge should be 400 thickness. That should be red color, and we have to mention that contagious waste, like that. Group B waste, sharp objects. All the sharp objects, we should keep it in a thick polyethylene plastic boxes. It should be in yellow color and mention sharp objects box. Group C waste, laboratory waste. All the laboratory waste we should be disposed through this blue color transparent bag. That should be mentioned to be autoclaved or sterilized before disposal. All the laboratory waste should be sterilized and then disposed next, and keep it inside the red color bag. Listen, before throw it into the municipality, throw it to the garbage areas, or go for the treatment. This laboratory waste should be sterilized or autoclaved and then disposed through the red color bag. And then group D waste, any pharmaceutical or chemical waste should be stored in the yellow color bag. Any poisonous materials or poisonous waste should be keep it in the yellow color bag and mention this is poisonous, or mention medical waste or chemicals, like that. And then group E waste. In the group E waste, patient secretions, stomach wash, for example, enema, vomiting, or diarrhea, those material we can keep it in the group E waste and mention medical waste of group E. And then group F waste, radioactive waste. In this radioactive waste, so here we are managing the healthcare waste management industry. This is the big industry in every states we have, Emirates we have. So they burn it, they crush it, and then they incinerate it. All kind of waste managed by these kind of industries. We should follow the municipality guidelines. We should follow healthcare authorities guidelines. As per the guidelines, every day the municipality will come and collect and dispose the waste. So this is my small information about the healthcare waste management. So we should keep our environment clean, safe, and healthy, and we have to give our environment to the next generation. So thanks a lot. So this is my shortest presentation about the healthcare waste management. But in the healthcare waste management, every country should follow the proper disposal method, proper guidelines. That guidelines, in accordance with the WHO regional office instruction, or the regional office guidelines or regulations. So that's it. This is my presentation.